my patients, when they come to me, they're very, very intellectual. However, I go beyond like intellectualizing. In fact, after a certain stage of therapy, I discourage intellectualization. I'm highly focused on doing, on acting. This because sometimes, patients, they can intellectualize, and I do not see it be manifested into the actual world, into the world of action. So intellectualization not necessarily like a plus for me for them to come into therapy. It's like people who are more driven, how do I do this, into the doing. So even people who intellectualize, I'll be then moving them into doing. Their chatter like in the mind is like, I cannot handle my anxiety anymore. I'm very, very anxious. I feel very depressed, or I like motivation and I feel numb. I just feel numb about life. I am experiencing extreme emotions, like I'm angry, frustrated, angry, like depressed, ashamed, feeling guilty, or I feel overwhelmed by this specific situation in my life. I want to understand myself better. I have a horrible inner critic inside of my head. I have, I have this very negative pattern of self-talking, and I want to break this pattern, in my life. And or I am scared, I'm angry, I feel devastated, I have no motivation. So this is typically, if I walk into my patient's mind, my favorite patients, those are the type of questions they have. A lot of like negative self-talking, inner critic turned on, uh, inner child that is not really fully getting their needs like acknowledged. In other words, patients who are not in touch with their emotions, or the opposite, the other extreme of being overwhelmed by those emotions. So this is what I encounter when I go into the minds of the patient that I work the best with.